Hey guys, we talked about finding your pulses the other day in lecture. I wanted to demonstrate finding those pulse points on a person just so you'll know those locations that you'll need to go to. First of all, we're going to start with the carotid. With our patient, remember we don't want to palpate bilaterally because you can occlude and make your patient pass out. So remember, your patient has their muscle right here and then their trachea. There's a little divot in between. With 2 fingers, you're going to press lightly and you should be able to palpate that pulse. This is one that's pretty familiar to you because we've learned that in CPR with someone we need to assess a pulse on. Next, we're going to move down to the brachial. This is one I find students locate in the wrong area. So a lot of times, people want to go right here in the middle of that brachial area. It's actually kind of off here to the side. And there is where hers is. I can feel it right now. So the best thing I know to tell you to do is just kind of put your hands right here, and as you feel the pulse, just kind of work in slowly to where you actually feel it. But a lot of times people's are not in the middle, it's off to the side, and that would be into your medial side. Next, we'll have our radial pulse. And we've got some extra bandages here, so make sure you move bracelets and anything out of the way. Radial pulse is another one that you're more comfortable with and you've used quite often. But remember, the radial side is where you're going to make the L shape, or the side that your thumb is on. Again, when you come right off where the hand meets the wrist, press real lightly, you should be able to feel it. They also have an ulnar pulse, which would be on the opposite side. Next, we're going to move down to the femoral artery. This is when you need to let your patients know, I'm going to palpate in your groin area instead of just going in there and reaching and feeling very uncomfortable. But with this, make sure you have your patient exposed, move their underwear out of the way, and you're just going to press down about midway into their groin area. Okay? So again, think about where that hip meets the groin area and it kind of creases. That's where you're going to be feeling, okay? Next, we're going to talk about the popliteal. The popliteal is probably one of the hardest ones to feel, and with some patients you can't almost palpate them at all. So the best way I know to do to tell you is practice on people that you know. But you're going to take your hand and stick it, I would start in the middle, behind the knee, the posterior side, feel in the middle, and then I would move to the lateral side. If you don't feel it on the lateral side where that tendon is, I would move to the medial side. A lot of times though, it's going to be either in the middle or more on that medial side near that tendon. And you have to really feel and be still because it's really hard to feel. Next, we're going to talk about the dorsalis pedis. This is the one that's right here on the top of the foot. The best way I know to tell you to do it is take your hand and put it across the top of their foot. You can feel it pulsating under your hand, and then you just want to start taking your fingers and moving it till you can narrow it down. Some patients' anatomy is a little bit different. You have that ridge right here in the top of your foot. Some patients will usually fall right just below that, and sometimes patients' pulse will fall right above it. So that's my easiest way I know to tell you to locate that. Last, we have the posterior tibia, okay? So with this one, I'm gonna move your leg out of the way, sorry. It is located kind of below the lateral malleolus, and the malleolus is this bone right here, your ankle bone. And if you take your fingers and just kind of go down, that's where you'll find it. Sometimes you may have to just move around that malleolus just a little bit, but it should be down and back just a little bit. There's a little bit of divvy right there, and you should be able to feel it there. If you guys have any questions, please let me know. I'll be glad to help you find certain pulses or go over these with you. Thank you.